Good day, everyone. I am Keana of the Discarga, and I am here to present to you our action research. So, COVID-19 pandemic. What comes to our mind when we hear or see the word COVID-19? So, according to the World Health Organization, coronavirus disease or COVID-19 is an infectious disease caused by a newly discovered coronavirus. So, this is nothing new to us. Coronavirus disease has been around in our world for more than a year. And it has caused a lot of major problems, not just here in the Philippines, but also all around the world. Now, it started when President Rodrigo Duterte placed the entire Luzon on a lockdown to battle the coronavirus disease here in the Philippines. Due to the nationwide lockdown, people's movements are restricted and protocols are enforced. That is, people are required to wear face masks. Business establishments were also forced to close down. So, according to the Department of Labor and Employment, over 2,000 establishments closed down due to COVID 19. Well, those are just examples of the problems that arose following the COVID 19 pandemic. Now, there are a lot of other areas greatly affected by this COVID 19, and one of those areas is the Department of Education. So, how did this pandemic impact the Department of Education? So, school establishments were forced to close down. According to the UNESCO, most governments around the world have temporarily closed educational institutions in an attempt to contain the spread of the COVID 19 pandemic. These nationwide closures are impacting hundreds of millions of students. Several other countries have implemented localized closures, impacting millions of additional learners. So, what are the drawbacks in the closure of these school establishments? So, the students are forced to study at their respective homes. They're either doing the online learning, the modular learning, or the blended learning. So, following the closure of these school establishments, again, a lot of unprecedented problems arise. And one of those problems focused on the rise in teenage pregnancy. According to the Rappler, teen pregnancy is the most important problem of women today in the Philippines, according to their survey. Furthermore, teenage pregnancy or adolescence pregnancy is a pregnancy in a female under the age of 20 by definition. According to the Philippines Economic Development Agency in August 2020, teenage pregnancy is considered to be a national social emergency. Why? Because of the rise in number in teenage pregnancy. Furthermore, according to the University of the Philippines Population Institute, 751,000 unplanned pregnancies are set to happen this 2021, which is more than last year, which is 42%. So the numbers don't lie, and as we can see, the rise in teenage pregnancy is very alarming. Some of the reasons that can be linked to the surge of teenage pregnancies are lack of access to birth control, lack of information about sexual and reproductive health and rights, family community, and social pressure to marry, and sexual violence. So, the rise in teenage pregnancy can be linked to the uh, COVID 19 pandemic. Now that the students are forced to study at home, they lack of information regarding this topic in teenage pregnancy and they lack of birth control knowledge. Now, one of the schools greatly affected by this rise in teenage pregnancy is the Cesar C. Tan Memorial National High School. It is a school located here in the Philippines in Quezon Province. It is located in a small island here in Barangay Cuatro, Quezon. COVID-19 pandemic. Teenage pregnancy has become a major problem for the teachers of Cesar C. Tan Memorial National High School. Did you know that there are 12 cases of teenage pregnancy in the school just in the year 2020 when COVID 19 happened globally, which is very alarming. And what can we think of solutions that will help stop this surge in teenage pregnancy? Now, due to the limitations of existing solutions in teenage pregnancy, we, the researchers, together with my co-researchers, Mr. Felix Balisa and Ma'am Mylene D. Galpa, and truly yours, I am Engineer Keana de Discarga. I am here to present to you our action research entitled ACAP, Activating Knowledge on Adolescence Program, Preventing the Surge in Teenage Pregnancy During the COVID-19 Pandemic. ACAP. ACAP is a term that is derived from the Filipino word yakap. Yakap is a Filipino word which means to embrace. So by embrace, what do we mean? What are we embracing? We are embracing the students by equipping them with knowledge and tools that will help them become aware of teenage pregnancy. So it is a way of helping them get back on track after they become pregnant. And also, we aim to stop the surge in teenage pregnancy by informing or activating knowledge upon the students in Cesar C. Tan Memorial National High School. ACAP is also stands for the acronym for Activating Knowledge on Adolescence Program, preventing the surge in teenage pregnancy during COVID-19 pandemic. Now, there are two programs developed by the researchers. Those are namely information sharing and financial intervention. So these programs were developed so the students would be able to have an information regarding the teenage pregnancy and financial intervention. Financial intervention is not necessarily about giving out money or cash. So I will be discussing that later on the following slides. So, methodology. How did we do this research? So, our research lasted on a duration of 6 months. The data were collected from 12 respondents of Cesar C. Tan Memorial National High School during the school year 2020-2021. The questionnaires are self-made by the researchers in line with the problems stated in this research. The respondents were administered by the researchers for the explanation of the purpose of the study. Parents of the respondents were also identified and were formally sent an invitation before an interview was conducted with their children. The researchers collaboratively asked and worked with the guidance counselor, teacher, advisors, and school head through the use of information sharing. So, information sharing. What is this program about? It is a program that aims to equip the students with knowledge about teenage pregnancy. This was done by giving out pamphlets connected to teenage pregnancy, by doing presentations in front of the students about teenage pregnancy and how to prevent it. So, as you can see in these pictures, we have administered our program by going to the respective homes of our respondents and giving out presentation to them and giving out pamphlets in order to equip them with knowledge regarding teenage pregnancy. Another program that we developed is the financial intervention. As I have stated earlier, it is not necessarily about giving them out money. It can also be through the use of crafts given to them. Financial intervention was given to the respondents in connection to green thumbs, plantitos plantitas, facilitating livelihood program and family planning. Livelihood program includes bread and pastry productions, cookery entrepreneurship, proper management, and costing. So we have given the respondents some crops in which they will grow, and who knows, it can also be a source of income for their incoming newborn baby. So this will help them in their livelihood, and they can also earn a lot of money from these crafts and from the bread and pastry and cookery productions that we have uh, activated in them. So what is the demographic profile of the respondents? So the age of the respondents have an age of 12 years old to 19 years old. And according to our graph, uh, 42% constitute greatly majority of 15 years old to 17 years old. And we also uh, included in our questionnaire their monthly family income. Majority of the respondents have a family income of 5,001 to 10,000 pesos. What is the situation of the respondents after they became young mother or father during the pandemic? So we use the Likert scale in our questionnaires. So there are 12 statements here. Number one, becoming a teenage mother or father is an unwelcome surprise for me, in which they strongly agree. They have less time to spend with their friends, strongly agree. They have no time answering the modules and studying, strongly agree. Their partner helps them in taking care of the baby, which is disagree. It is easy to become a teenage mother or father since responsibilities are shared compared to those older parents, strongly disagree. They had conflict with their family values, strongly agree. And as you can see, their parents support them in being a teenage mother, disagree. They hate their parents because they didn't guide them enough, agree. They are having financial problems, strongly agree. I have a source of income to support for our expenses, disagree. I have knowledge on what to do after becoming pregnant, strongly disagree. How effective are the programs established by the researchers in stopping teenage pregnancy in terms of information sharing? So in this one, we also use the Likert scale in order to know how effective our program is to the respondents. So the first one is information sharing. So as we all know, we have given them crops, and according to the Likert scale, it is proven to be very effective as all of their answers are strongly agree. They all strongly agree that the crops given to them can help relieve their stress. It is easy to plant in their backyard. They can benefit from it. They could earn money from it. And the pamphlets given to them are easy to understand. There are also baking recipes and cooking recipes that is given to them through the form of pamphlets. And it is also proven to be effective as they all answered strongly agree. The other one is how effective are the programs established by the researchers in stopping teenage pregnancy in terms of financial intervention. So we also use the Likert scale in order to know how effective is the financial intervention program in helping them in their teenage pregnancy. So it is also proven to be very effective as the pamphlet on teenage pregnancy is very informative. They learned a lot from the from the pamphlet given. They have become aware of their situation as a teenage mother or father. The pamphlet gave them knowledge about teenage pregnancy. So overall, the pamphlet given to them is proven to be very effective in helping them know about their status in being a teenage pregnant. So for conclusion, number one, from the data obtained from the demographic profile of the respondents, the family monthly income were also taken and results show that majority of the respondents have a family monthly income of 10,001 to 15,000 pesos. It also showed that majority of the respondents have an age that ranges from 15 to 17 years old, which is very alarming considering that they are only 15 to 17 years old, yet they are already pregnant. Number two, results showed that majority of the respondents weren't ready when they became teenage parents and that it caused them to have no social life and have no time to spend with friends. It can also be concluded that many conflicts arose when they became teenage parents, such as having financial problems, having conflict with parents, and having problems with taking care of the baby. And last, number three, the programs on information sharing and financial intervention are proven to be effective for the respondents who became teenage parents. It can be used in the long run to prevent the surge in teenage pregnancy, most especially the pamphlets regarding teenage pregnancy, and can be a way for those teenage parents to start earning money from the pamphlets given and also the crops given. So that will be all. We are Team ACAP, and thank you.